last year because the coalition has grown quite a bit. And we do meet every other month, and then we have a large event in September for National Falls Prevention Awareness Month. Next slide. These are just some other opportunities. I think the committee work is where a lot of the work of Falls Free Dane happens, and where a lot of the growth of our coalition has happened and has helped us kind of level up in our presence in the community and kind of formalizing the tools that we have and how we get that out into the community. Um, Next slide, please. And I think that's it. I can't believe I made it within the time. If anyone has questions afterwards, I'm happy to have a conversation offline. And also, I will probably be reaching out to some of you to learn more about your coalition work and to invite you to one of our coalition meetings because I think so much learning can happen when we talk to one another. So thank you for what you all are doing across the state and for sharing what you do.
Awesome. Thanks so much, Ashley. Apologize about the technical difficulties on my end, but I'm going to move it over to Fond du Lac County and turn it over to Kelly.
I'll piggyback what Ashley just said, that reaching out to other coalitions. I started this coalition in Fond du Lac, Standing Strong Against Falls in 2023, and I needed a lot of help. So I had no idea. This is not my background. My background's emergency nursing. So in my trauma role, I've been able to kind of embrace this injury prevention initiative within my trauma role. So the learning has been immense, but certainly reaching out to like Ashley and all the individuals that have helped me get to where I am so far and moving forward. So kind of the structure for our coalition is we meet monthly, and as a general coalition, and anyone that wants to come virtually or in person, we just kind of have conversations. We go through topics, we go through ideas, we go through events upcoming, and anything that we can kind of get out there and get moving forward. But we do also have a couple subcommittees, our logistics committee, which is kind of, I like to say, we work on the whole well-rounded approach of that patient care. So with all the different organizations and everything that we have working together, that EMS to ADRC referral, that EMS to hospital, and kind of that whole circle of care is to try and close that circle, as to the patient doesn't get dropped between the ADRC referrals or from the hospital, and then that discharge back around to home, and kind of trying to create that nice circle of care for that patient. Because just because the patient left the hospital or just because EMS is done with the care doesn't mean that patient isn't still our patient. So and then prevention, they kind of work on the events and anything that we can do for our community. So presenting at senior centers, local like senior expos that we have, getting ourselves out there in that community. We have marketing that's working on different projects. So currently they're working on, one of our goals from the beginning has been not just older adults. Our main focus certainly is older adults, but kind of all aspects of our life, falls prevention. So, focusing on that 40, 50, 60-year-old age group, as to, yes, you're doing okay now, but you're kind of on that borderline as to, I hope you realize, or you don't realize, or maybe we should realize and work on the fact that we will be older adults as we get older, right? So what we can do now to kind of work on that and prevent it. So, and then we have a fundraising committee that we do as needed. We have never been funded. So we kind of have like reached out to different resources that we've been able to kind of borrow. And we work strongly with the Southeast Region Trauma Advisory Council through the state of Wisconsin to be able to kind of get some funding from them, and then local things that we do to try and, get care moving forward. So next slide, please. I also wish I would have seen everybody else's presentations because I would have had a better idea of what I should put in here. When we were created in 2023, kind of that knowledge base of learning the data point that Wisconsin is the worst in the nation for deaths after falls. That was just, it hit me as to like, why are we the worst by almost double the national average? What can we do? We should be doing more. We can be doing more. And because injury prevention is part of my job description, I was able to kind of branch out and create this group and meet all these wonderful people and kind of move this work forward. So, um, sorry, next slide, please. These are all of my wonderful community partners, and I'll say these are the active ones. So these are people that show up. These are people that attend online. And I think now that I'm looking at this, I missed a couple. That would probably be sad that they're not on here. But it's been awesome. It's been amazing to meet with these individuals, and the amount of passion that everyone exists and has for this group of people for older adults has just been insane. And the amount of knowledge that I can get from this group of people is never ending, I think. I'll always keep learning. Next slide, please. So accomplishments, one of the first things we did was, copy and repeat, right? So steal shamelessly, those are mottos I live by. So I stole Kathy Green's better, finding balance together placemat. So we created these placemats for Fond du Lac County with kind of some Fond du Lac statistics and different things that we're able to give out into the community. And we've sent them with kind of like our Meals on Wheels type programs to get them out there. And I always think that like if I sat down and there was a placemat there for adults, I would totally fill it out. Like it's not just for kids. Anyone would do this. So we also have started a community educational presentations, kind of the Rotary clubs and different organizations. Early on, very early on, like meeting number 2, we met with Rebuilding Together, Fox Valley, and they have been wonderful partners from the beginning and have really worked with us to get this up and running. And then we were able to bring rebuilding Fox Valley to Fond du Lac County, getting them funding to be able to provide home modifications, which has been amazing. Our hospital talks about it. I work for SSM, talks about it all the time. They're like, what's that group? What's that group that you work with that, will do home modifications? And they're pushing that name out there as well. So it's been wonderful to work with them. We worked with the Waukesha Coalition because, like I said, reaching out to all these coalitions, and Waukesha is newer too. So we came together to create kind of a falls prevention magnet with the 5 exercises on it. And we now have those, which were nicely funded from our Southeast Region Trauma Advisory Council because they're wonderful people and they want to support us. So we're able to get those onto the community now too. It's kind of that visual reminder every day to do those exercises. So I'm really excited about that. We also are using the falls prevention folder and have copied that over into Spanish. I do also put more Fond du Lac specific items in there for our community. And then we were able to bring Stepping On to our area and activator pole classes to our YMCA, which I didn't know that was a thing. And I learned about it from a senior presentation symposium that I went to last year. And it's such a cool thing because they look so cool. It looks like you're just being athletic and you're using these walking poles, which are actually engaging your core and keeping you safe and helping you be stronger in your everyday life. So they're really cool. Challenges that we have, time. I have a full-time job. So like, this is just a side note. Like, this is something I do for fun as part of my job. So it's a lot of it just trying to connect. And this year has been rather rough because of my full-time jobs, expectations and responsibilities that I have. I have 3 site surveys that I've had to do this year, so or are still working on. So some of the work has kind of paused a little bit, just in the fact that I don't have the time this year specifically. Currently, I met with Ashley recently as to like, what do I do next? So like, we got to this point, but like, what's next? Like, how do I push this forward? How do I keep people engaged? How do I, where do I go from here? So that is currently something I'm working on, and then getting that information out there, getting those community members in, is another challenge that we're currently having. I think there's one more, right? One more slide.
I think you have 1 or 2 more, but we do have to wrap up. So it just looks like this is the image of the placemat.
Yep. So there's a placemat.
And
then next slide. And the magnet, maybe. There it is. And I think that's it.
All right. Thanks so much, Kelly. And I think last but not least, we have the Brown County Falls Prevention Partnership. So much to take it away.
Yep. Hi, everybody. I'm Michelle from Brown County ADRC. So a little bit about our structure. Our name is listed right there. We have a logo that we also use on all of our materials. Our structure is laid out in monthly meetings. We go all year long. Chairperson leads the agenda, but it's very much everyone participates in a shared leadership model. So if somebody has to be gone, someone jumps in right away. We have 16 to 18 active members, so it's a pretty strong group. That just happened this year recently. This group's been together for probably at least 10 years now, before my time at the ADRC. But in this past year or so, we've really grown the membership and provide a much bigger cross section of representation from our community. All of the health systems are represented. ADRC obviously is representative. We also have YMCA's. We have a Croc Center represented. We have different health departments, Brown County Health Department, De Pere Health Department. So we have a pretty good cross section of individuals as well. So some of the things that we work on in our meetings, we review our events, the marketing, our quarterly program flyer, which we'll show you in a second. We offer lots of workshops in the community. We do stepping on lots of things. I didn't list them all out here yet, but this is kind of the flow of every month, what we cover. We do partner report outs, and then we also participate in planning 1 to 2 special events each year. And then we have a program feature every month. So if there is something new and different happening in the community, we need to share it with everybody. We make sure that we have a placeholder for that every month during the meeting. And in fact, I believe, I think it's this month or August. I can't remember. I believe Ashley from Dane County has come. So we're bringing other counties up to tell us some cool things that they're doing. So again, that theme that everyone shared about learning from each other. So we're excited about that. Next slide. Some of the accomplishments. So one of the things that we worked really hard on this year, and there's so much to it, but I quarterly event flyer that all the partners and all of the programs or workshops that we're offering goes on one document, and then we all cross market that document. And we actually have found that the feedback from our customers is that they really want to go to one place to see the information, and we don't have the resources right now to like create a special Facebook page or anything like that. So we just decided to do a electronic document and a print document that all of us can distribute at our organizations, which has worked out really well. And it's one place where customers can go to see everything going on in the community on a quarterly basis. I think the shared responsibility for presenting allows for a greater reach in the community, and that's very specific to one of the educational workshops we provide called Feet First Falls Prevention. And originally, it was only 2 or 3 people in the community that could do that presentation, and we spent this last year getting other individuals cross-trained to provide that educational workshop, and we've been able to just quadruple the amount of educational workshops that we're providing in the community all over the place, whether it's at a church, the ADRC, a library, the YMCA, the Croc Center. We're able to get the information out on falls prevention. And our workshop has a lot of the toolkit components that many of you showed on your presentations earlier. So we cover all of that stuff. So safety in the home, working with your medical provider, medications, using actual support tools and resources that way, like right way to use canes, wheelchairs, poles, walkers, all that kind of stuff. So, and then annually, one of our accomplishments is our Freedom from Falls, which I'll show you on the next slide. Our biggest challenge, I would say right now, beside funding, we don't receive funding either. If we need money to do something, it's a special grant. We reach out to our regional trauma group as well. So we don't have this consistent dollars either. We didn't receive any ARPA dollars. So it's really that grassroots effort. But the biggest challenge we've probably found is the complexity with all our organizations, especially healthcare, about marketing requirements and limitations at each agency or group. You know, for cross promotion, there's certain criteria you can and can't do on social media for certain groups. So it just makes it a little stickier, and it's not as easy as you'd like it to be able to immediately put things out. So next slide. This next slide has some examples of the 2 things I mentioned, which one is the quarterly flyer. So you can see that we use the logo. And then you can see all the programs that are happening in that quarter, who's hosting them, where they're located, and who to contact. So that was a big milestone. So anyway, Very exciting with that quarterly news piece and flyer that we promote. And then the right-hand side is just an example of the cross-section of information, presenters, literature that we're doing for our Freedom from Falls event in September. So you can kind of see it's like an all-day event. We're doing something unique and interesting. It's at the National Railroad Museum. So at the conclusion of this event, which is educational speakers, lunch, screenings, everything like that, then we're all taking a train ride. So that's kind of exciting, but I just wanted you to see kind of the cross section of all the players who step up to present in events like this. So we're a really engaged partnership, but we're always looking for ways to grow. So I definitely saw quite a few ideas that I'm probably going to steal from multiple people that I think will enhance us too. So, and I think that's it. Suzanne?
Awesome. Thanks so much, Michelle. And I just see the contact information on the screen. I know that was fast and furious. That could have been like a 2-hour long meeting probably, but just a quick little snapshot of all of the amazing things that are happening throughout the state with the local coalitions. Definitely saw lots of collaboration and comments in the chat, so definitely feel free to keep doing that as we move along. But if there are any questions for any of the presenters specifically, definitely throw them in and we can definitely see if we have time to get to those. Just a few Falls Free Wisconsin Coalition updates. As a reminder, we have these resources for caregivers. They are downloadable and printable handouts on the Falls Free Wisconsin website. So just another plug for those. And then earlier this week, we sent out a survey that is through the grant that we received from the National Council on Aging. We're part of the Strengthening State Falls Prevention Coalition's project. So this survey will be put out through NCOA 3 times during our grant period, which is 18 months. So the first survey is open until July 22nd. I'll be sending a couple reminders, but we really, really would appreciate it if you would help us fill out that survey and provide feedback. A couple different things coming up. So like Ashley mentioned, we have a webinar, a pop-up webinar coming up on Tuesday, August 19th. I'll be sending out the registration and information for that shortly. But Ashley will be sharing, Ashley and Darcy from Safe Communities Falls Free Dane Coalition will be sharing about their Balanced Stamp of Approval program. And then I'll be sharing about the upcoming Falls Prevention Awareness Month updates. So lots of comments in the chat too about magnets. So since we're on the topic of magnets, we also have a design contest happening now for Falls Prevention Awareness Month. So the submission criteria is on the screen. I'll also send it in the follow-up. And of course, the great magnet that was created is on there as an example. We have our design contest open until July 25th. So really encourage you to share this with your partners as well. This is similar to the placemat contest that we did last year. So putting information on there to hand out in a magnet or even a sticker at different events, at lift assist calls with EMS, different opportunities like that. And then monetary prizes will be awarded to the organizations that win first through third place with their design. And just another plug for our Falls calendar, event calendar. So this used to be just 1 month for September for Falls Prevention Awareness Month, but this is now for year-round activities. So I heard of a lot of great activities being shared during the meeting today. So you can see on here, there's a couple of the Feet First Falls Prevention talks from Brown County on the calendar for July. And I'm sure this will be filling up with August and September coming up, but definitely submit your events. This is open for anyone that visits the Falls Free Wisconsin website to see it. And then I think maybe just 1 or 2 more updates for Falls Free Wisconsin. We are hosting a special screening of the Denying Gravity play. So this will be taking place on September 9th. This won't be recorded. We're not allowed to record the film screening, but we're hoping to play this maybe some additional times later this year, maybe next year. We will also be doing an in-person screening of the Spanish version of the film, but those details haven't been finalized yet. So more information will be coming on this, but it'll be the film screening and then a panel of experts afterwards. And we are looking for sponsors for this film screening. So if you know of any local partners that might be willing to sponsor our event screening, you can always reach out to me as well. And then if you weren't on We Has office hours this morning, just a quick update on healthy aging grants. We weren't included in the final state budget, but we are working on a bill with Representative Gundrum to submit and hopefully move forward this year to get that funding for healthy aging grants and support falls prevention efforts locally as well. So with that, we have 4 minutes left. I'm kind of breeze through everything. I'm hoping we get the recording after this, but if there's any other local updates that no one shared during their presentations today, or if anyone else wants to share, communication tips, events, questions, challenges, resources, feel free to drop those in the chat or come off of mute. And while I'm waiting for those to come in the chat, I did have a question from someone, I believe it's in Trumbull County earlier this week. Someone was wondering about doing this bingo. An example is on the screen for a brain health bingo, but wanting it to be a falls prevention bingo. So wondering if anyone has done this already so that they can just feel it. That was kind of the theme of the meeting today too, just copying and pasting, not having to reinvent the wheel. So I think the purpose of this is to hand this out to older adults and then have them complete one of the, at a bingo and hopefully complete at least a bingo, if not all of the completed card back to an EDRC or a senior center. But then instead of it being brain health activities, it'd be falls prevention event activities. So if anyone has done this before and would be willing to share that, that would be fantastic. Or if anyone wants to take it on and do it and share it out with everyone, that would be great too. Oh, Nancy, it sounds like you guys do have one. That would be awesome. If you could share that, and I'll make sure I share that out with everyone as well. Anyone has anything to share? We have about 2 minutes left. Okay, I see you didn't design it. It's from a university. Hopefully it might be something that we can still use or recreate as well. I'm not seeing anything else, but thank you all for sharing about all of the amazing things that you have going on in your local communities. Thanks to all of the local coalitions for doing what you guys do and, collaborating with each other. Again, we don't have to recreate the wheel, but I think it's super important to learn from everyone, whether you've been doing it for 10 plus years or you're kind of new at it. So definitely feel free to keep in contact with each other. I'm happy to share contact information. If you don't have it, you can always reach out to me, and definitely keep looking out for Falls Prevention Awareness Month materials. Those are coming soon. And we have a couple meetings scheduled. So the August 19th pop-up webinar, the September 9th film screening, and then a regular meeting on October 9th. So thanks everyone. Hope you have a great rest of your day.